My name is Dr. Carrie Clark. I'm a pharmacist. The hospital has had Cardinal Health remote order entry system for 2 years. It was originally implemented because of the new technology that we were implementing at the hospital, our Omnicell cabinets, and we needed a pharmacist after hours to verify orders so that the nurses could get the medications for the patients out of the new system. But since 2 months ago, we extended the hours that we utilize the Cardinal Health remote order entry system because we have implemented a clinical pharmacist rounding position. I or one of the other pharmacists no longer has to be confined to a computer all day verifying orders. We are out talking to each patient every day, counseling them on their medications, monitoring anticoagulation needs, clarifying their allergies, and it's just been excellent for the patients. We're able to give them the time and attention that they deserve. Now we can work as a collaborative team with the physicians, nurses, everyone in the hospital. The physicians really value the input of a pharmacist, and the nurses have lessened their burden with medication reconciliation because we are able to help with that now. In addition to the direct patient care that we are able to provide now, some of the other benefits to the Cardinal Health system that we have noticed is we no longer have to play catch up in the morning because the Cardinal Health pharmacist has done that in real time just like we do during the day. Since we've introduced the Cardinal Health remote order entry system, we have reduced medication errors, we have increased our transaction time, the medications are reaching the patient much faster and increasing patient safety and providing better patient care. It is so important that while we are not here, that our clinicians, our providers, our nurses, and ultimately our patients have a lifeline to the clinical service that Cardinal Health provides.
My name is Tim O'Neill. I'm the Director of Pharmacy at Noble Hospital. Before we brought in an overnight service, we had the administrative coordinator who would come in and do all of the medication needs for the facility. We were looking for somebody that basically mirrored our image. I wanted somebody that would do exactly what our pharmacist would do, and we could only get it from Cardinal Health. The remote order entry really gives me a sense of peace of mind. I can really, count on them to do exactly what my pharmacist would do. Their pharmacists are considered to be my pharmacists, and that's something that really you can't get with a lot of the other services. Cardinal Health was very willing to help us here at Noble Hospital. They actually sent out a clinical pharmacist who reviewed all our policies and looked at our procedures and actually followed a clinical pharmacist around to make sure that they're following exactly what we do. I have monthly meetings with the nurses concerning Cardinal Health, and we have had any issues since we started 3 years ago. It's been a very smooth service, and I'm very appreciative.
My name is Sandra Donald. I'm the Director of Pharmacy here at Boone County Hospital. As a part of Cardinal Health, we did a Kaizen event that determined some of our medication errors were due to after-hours pharmacy not being available to our nursing staff, and we determined that it would be helpful to have a consistent process, and so we decided that remote order entry service would be very beneficial to patient safety. It's important to me that our pharmacists are working out of a licensed center because they can pull from each other's expertise. Each one has their specialty, and we have a lot of different patient types here, and also that someone is looking over them and is monitoring their activity. I'm very confident with our remote order entry pharmacists. They're very easy to work with. They're very knowledgeable. They dose antibiotics that need to be dosed. They handle patients that need to be handled. They answer questions that need to be answered. And they understand how a lot of different hospitals work, and they pull that all together to work in my hospital. It's really freed us up to take care of those more difficult patients, the ones that need a little extra attention, a new baby, a patient in our intensive care unit, someone that just takes a little extra time and effort. It's helped us become better pharmacists. Cardinal Health's remote order entry service gives us improved patient safety. That's really what we were looking for.